Hi, today we're going to talk about anemia and in particular iron deficiency anemia. First, I want to say that iron deficiency anemia is probably the most overdiagnosed and misunderstood health problem for the medical profession today. Anemia means not enough iron in the blood. And we're going to talk about how you come to that conclusion and what iron and storage iron means. So when you get a blood test from your medical doctor and you are interested in whether or not you have anemia, the first thing you need to look at is your hemoglobin level in your full blood count. Iron in the body, 80% of the iron in your body is used in red blood cells to make hemoglobin and myoglobin for your muscles. So iron is the founding ingredient in heme, and heme is the protein that's made and used in the bone marrow when it makes hemoglobin. And hemoglobin is the molecule in your blood that travels around on your red blood cells and delivers oxygen to your cells and takes carbon dioxide from your lungs and gets it out of your system. So hemoglobin is the most important thing to look at. If you have hemoglobin that's normal, then you are not anemic. You can only have anemia if your hemoglobin level is low. So often your doctor will only look at your iron levels and your ferritin levels and make a diagnosis of iron deficiency anemia, which is incorrect. So we want to do an iron panel, which includes iron and ferritin, and a couple other things called transferrin, TIBC, and percent saturation. Now this iron panel is useful because it tells you how much iron is in your blood and how much ferritin or storage iron is in your blood. So they have a certain level of iron that they consider normal in your blood, and ferritin has a very extremely high normal value, which I would consider toxic in the standard blood profile in the medical profession. So your body will take iron from your blood and put it into your cells whenever you have an infection, because all pathogens, whether it's virus, bacteria, or fungi, protozoa, they all eat iron and require that for their survival. So your body has a wonderful defense mechanism where it takes iron out of your blood and stores it in your cells temporarily until the infection goes away. Now, if that happens, then you will survive that infection, and there's just enough iron left for you to continue making your red blood cells to keep you healthy. Your body is smart enough to do that for you. But what about that iron that is moved from your blood and goes into every cell of your body? Well, that iron requires a molecule called ceruloplasmin to get it out of your cells and back into the blood where it belongs. So the blood cells can be recycled, and 98% of your iron is recycled in your body. It's a very efficient system. So at most, you would need 1 milligram of iron per day, which is not very much. If you're having a hamburger or steak, and you have your 300 grams of meat per day, certainly you're getting plenty of iron, and you also get iron from other foods as well. So the problem is not putting more iron into your body. You only need 1 milligram of that per day at the most anyway. So oftentimes people are being misdiagnosed with iron deficiency anemia based on only looking at your iron and ferritin levels in your blood and not looking at the ceruloplasmin, the molecule that you need to get the iron out of the cells and back into the blood, where it can be recycled by your spleen and made again in your bone marrow, which makes the red blood cells for the haemoglobin, which transports the oxygen and gets rid of the carbon dioxide from your cells. So that's how iron and ferritin are distinguished in the body, and it's very important to realize whether or not they're in the blood or they're in the cells. Now, we have great medical tests to determine how much iron and ferritin are in your blood, but we don't have any tests that tell us how much iron is in your cell or in your mitochondria, where it's plugging everything up, and toxic unbound iron causes free radical production in the body, which causes cancer and genetic mutations. So it's a free unbound toxic iron in the cells and in the blood that we're worried about. Now, as I mentioned, ferritin, if you find it in the blood, that is a sign of pathology. That means that you already have cell destruction, maybe in your liver or your pancreas or some other organs, and the destroyed cells leak out the ferritin into the blood, and so you have elevated ferritin levels in your blood, which should not be a sign of iron to your medical practitioner. It should be a sign that you've got pathology, you've got cell destruction. There's something creating this problem of too much iron, too much ferritin in your blood. So what we really need is a test to determine how much iron are in your cells. And right now the only way to do that is a MRI, specialized MRI tests, which are very costly and expensive. So we have to determine how much iron is in your cells and how much ceruloplasmin that you have to get the iron out of your cells and back into the blood where it belongs. So if you're diagnosed with iron deficiency anemia, first thing you have to look at is your hemoglobin level. If your hemoglobin level is high or within normal limits, then you do not have iron deficiency anemia, even though your iron level and ferritin level may be low. If that is the case, then you do not have iron deficiency anemia, you have anemia of chronic inflammation. Now, anemia of chronic inflammation means that you have low iron in your blood and low ferritin level in your blood, but this is caused by a completely different process of chronic inflammation, which we'll get into in another video. So many people are misdiagnosed with this problem of iron deficiency anemia, and really the only way that you can get iron deficiency anemia is if you have blood loss. So if you're in an accident and you lost, a lot of blood, then yes, you could be iron deficient in your anemia. If you have excessive menstrual bleeding as a woman every month, then okay, maybe you can develop iron deficiency anemia. Okay, but giving you iron, looking at a blood test and saying that you're low in iron in your blood, and then just giving you heaps of iron to get that iron level up in your blood, first of all, it will only be a temporary solution, because after a while your iron will go back down again. And it's very simple thinking, in that if you're low in one thing in your body, all you need to do is take that substance and it will get higher in your blood. And your body just does not work that way. The only exception would be magnesium when you test your level of magnesium with a magnesium RBC. So iron deficiency anemia is a overdiagnosed condition, and probably most people do not have iron deficiency anemia. They probably have anemia from chronic inflammation. With anemia of chronic inflammation, the problem is not getting the iron out of the cell and back into the blood. So that's due to a lack of ceruloplasmin, which is the transport molecule to get iron out of the cell and into the blood. This is caused by a lack of whole food vitamin C, which is stored and used up in the adrenal glands under stress. So you can see that chronic stress causes a depletion of the adrenal glands, which are the organs which react to stressful situation, or your fight or flight mechanism. If someone scares you and you tense up, any stressful situation will cause that reaction of the adrenal glands, which uses up your vitamin C. Now, we've been taking ascorbic acid, which is a man-made product, thinking that it's vitamin C, but it's a completely different molecule. So if you had two identical cars next to each other and you opened up the bonnet of one, and there's an engine and a transmission and all these moving parts in there, that would be similar to vitamin C. If you opened up the bonnet of the other car and it's empty, there's no engine, there's no motor, no transmission in there, it's just an empty shell, and that's exactly what ascorbic acid is. It does not have the same makeup, or molecules are completely different from the vitamin C, whole food vitamin C, and ascorbic acid. So that's one of our deficiencies these days. Besides lack of magnesium, we also have a lack of whole food vitamin C, which is required to make the ceruloplasmin molecule, which gets the iron out of the cell and back into the blood. Now, you also require vitamin A, specifically retinol, which is most often found in animal fats, and the retinol is required to load the iron onto the ceruloplasmin to get it out of the cell. So magnesium is required, vitamin A is required, ceruloplasmin is required to get the iron from the cell where it's toxic back into the blood where it belongs, where it can be utilized in the body to make hemoglobin, to transport oxygen and get rid of carbon dioxide from your body.